Welcome to our daily press briefing. With us today is John Woodrich, Chief Executive Officer of Bryan Medical Center, and Jerome Berry, one of our directors. Among the things that Jerome supervises is pastoral care and the Bryan Independent Center. We thought this might be interesting in light of some of the processes we've shared with you, specifically the visitor process. There's probably nothing that had more thought, consideration, and anguish, frankly, for us of when we've had to put these in place. If you recall, we've gone from limited visitors to 2 visitors to 1 to 0 if you're a COVID patient. And if you're one of those lucky ones that can visit a family member, you must pass a temperature screen as well. So this impacts certainly our clergy in the community, the families, and now our staff that are the people there that are providing the comfort and support, and that certainly includes our chaplain. Some special things going on for Easter and Ramadan celebrations here on our campus. Then the other aspect of Jerome's presentation, we're very strong advocates for social distancing, but boredom and loneliness are bad combinations for those struggling with recovery. So Jerome's here to give some information on that. Real quickly, an update on PPE. A lot of questions have been coming in on that, and John had the appeal for gowns yesterday. I want to put this into context for you. In early March, we were using about 1,400 gowns per day. With the significant clinical and infection prevention kind of efforts to modify our practice, elective surgeries, all of that, we dropped to about 622 gowns per day. What we're allowed to do right now is purchase 4,040 gowns per week from our vendor, and that is based on our 12-month order history. Now you add to it that we have the potential to use 150 gowns per day for a single COVID-19 patient. If there would be 50 of those patients in isolation, that you do the math, that is a lot of gowns a day, like 7,500, more than we can buy a week. So that's why the effort to supplement the supply chain is so crucial. Additionally, we have 100,000 disposable gowns that are on order from China that we expect to receive them by the end of April. And we have 3,000 washable gowns from Mexico that should be here a little bit sooner, but also later in April. So I want to remind you of Sarah Morris, who we had up here a few days ago talking about setting up our Bryan Urgent Care Respiratory Clinic. So that's our day job right now. At nighttime, she's a volunteer like so many others, doing all she can to keep our staff and patients safe. So a friend of hers is a woman by the name of Jennifer Blackburn Nielsen, who is the owner of Blackburn Manufacturing in Neely, Nebraska. They are a manufacturing company that primarily makes marker flags and different signs. And I think it's kind of cool too. Neely was the first hospital to hook up with Bryan in a hospital-hospital telemedicine partnership. But Sarah contacted her friend, and they got a big roll of this plastic material delivered down to Lincoln. Jackie Lawrence in our distribution department, and also our friends at Tabitha, developed a pattern to test this. It was taken out to Duncan Aviation for cutting, and then Duncan Aviation arranged sewing groups of their employees at Duncan, St. Mark's Methodist Church, Berean Church, and Pius High School. And they have come up with something that is safe and disposable and will be used here at Bryan. We'll want them to make as many as possible, but I won't try it completely on, but you can see goes over the head like that. You have arm sleeves, and then it ties in the back. And what we do believe we'll do is be using these at our Bryan Urgent Care Respiratory Clinic and our drive-through clinic. So great to see the support from Nebraska companies, and then again, so honored to have employees like Sarah Morris on our team. Midnight census, we were at 363. Bryan Easy visits, we have now screened 8,548. It has resulted in 2,326 easy visits, and 1,080 of those folks have used the COVID promo code. Testing results, at Bryan Urgent Care, we have now tested 101 people for COVID-19, 4 positives, 85 negatives, and 12 are pending. At the drive-through clinic, we have tested 717 individuals, 25 positive tests, 596 negatives, and 96 of them are pending. At Bryan Medical Center, we have tested 229 with 11 positives, 172 negatives, 46 pending, 18 of those are in-house. And that brings it to a total. We have now eclipsed 1,000. 1,047 individual or tests have been administered with 40 positive test results, 853 negative results, and 154 pending. So John will share a little bit more about what's going on in the medical center with these tested patients and our bed availability as we promised. With that, I would like to invite Jerome Berry to the podium.
Well, thank you, and good morning. I appreciate the opportunity to give a little perspective on how this virus has impacted specifically our pastoral care team. As Bob mentioned, when we made that tough decision to restrict visitation, I don't think a lot of people realized that that would include community clergy. So community clergy who regularly come to both Bryan East and West and visit patients were unable to do so. And you can imagine a chaplain's heart in situations like this. They want to connect people together, not separate them. So they got together and came up with a really clever idea. We've got iPads purchased, one for East and one for West. The chaplains are able to take that iPad into a patient's room that may not have brought their phone with them, that may not have an electronic device, and they're able to sit there with them and get them connected to either a loved one or to their pastor out in the community. And I'm starting to hear some really good stories that are coming out of that little effort. At the same time, we're trying to get both of our chapels ready for Ramadan that's coming up here on April 23rd, and allow our employees that worship in that way to be able to go into our chapels and maintain social distancing and have that available to them during Ramadan. At the same time, getting ready for an electronic version of our Good Friday service for this Friday for that segment of our population. And it's hard. This is the first time ever. I don't think we've done live Good Friday services. But again, trying to find ways to meet that need. The other thing that I'm really proud of with our pastoral care team is they're going down to LifePoint on a daily basis at 1 p.m. and being there with that team of healthcare workers that's about ready to go out into the drive-through testing site. And there's a group of anywhere from 20 to 25 individuals standing there, maybe more, getting ready to go outside at 2 o'clock. And so we take that opportunity to share a real brief devotional and pray over their work and pray over the anxiety that people are experiencing as they come into that site for drive-through testing. Switching gears now, I want to talk briefly about our recovering community. It's a population that I think we sometimes forget in situations like this, but there are lots and lots of people out there in our community that are trying to stay sober, trying to stay clean. And I think we all know that stress and boredom are tough times. And for a non-addict, stress and boredom is a tough time. We resort to things that give us comfort, whether that be food, drugs, or alcohol. And we have to watch ourselves when we're stressed and bored for those. But imagine being in recovery and having stress and boredom and all of a sudden having your support groups taken away from you. The social gatherings of AA, NA, Celebrate Recovery are gone in many ways. But the good news is that population in the recovery community, it's a we group of people. They're very social. The focus is on fellowship. The focus is on gathering together. The focus is on giving back and lifting each other up. So the recovering community out in Lincoln has really stepped up, and there's lots of options available for them now on websites, on chat lines, on virtual, on conference calls, a lot of different media options for them to still gather together. And isn't it interesting? We're gathering together using the tool that we used to say, don't look at that quite so much, and now we're saying it's of great benefit now to that population. So I think it's hard for those people that are in recovery, but it's even harder for those that are new in recovery or those that are considering getting into treatment. So at the Independent Center, that's impacted us for drug and alcohol treatment because our focus historically has been on group therapy. and we've had to gradually minimize the group offerings that we have and increase the individual options and stay connected with our clients in that way. And we think we're going to be able to go live with telehealth this next week as a way to stay connected with them in that way. So lots of good things going on, lots of resources, but I just wanted to lift up the recovering community and put our focus there. Thank you.
Thanks, Jerome. I'm John Woodrich, CEO of Bryan Medical Center. I wanted to give you an update on some of the numbers that you guys have been asking questions about. So we shared with you we have 40 positives so far to date. I do want people to understand that we are retesting people at times. So from a unique patient standpoint, it's really 36. Trying to keep the numbers differentiated between unique and retest. I just want people to know at times they will hear varying numbers. And of the in-house, of the 18 that we currently have pending, 10 of those individuals are from outside of Lancaster County. I think I shared with you before, we service a good portion of Nebraska. 8 of those individuals are Lancaster County residents. We do have 6 positive COVID patients in-house right now. 5 of those are from Lancaster County. 1 is from outside of Lancaster County. With the 6 positives in-house and the 18 pending, that makes up 24 individuals. 4 of those individuals are on vents. 9 of them are in ICU, 6 are in our progressive care unit, and 9 are in our general care units. We are working with the health department for, as I mentioned before, people from the mission, homeless folks, and prisoners, or what we refer to as forensic patients. So the health department would probably be the best one to answer those questions. They would come to the hospital. That's an everyday occurrence. We take care of forensic patients all the time. They'll basically have a guard on duty with them here. So we've done surgeries and about anything you can think of healthcare related. So we would treat COVID-19 patients no different than we would any other patient that would come from our prison or our correctional facilities.